sharing your thoughts. This is a completely judgment-free space. But it's very interesting, the words that we use around behavior just got me thinking about that. And, things like acting out or
Mm.
misbehaving, or naughty. These are all words that adults use when we talk about behavior. Not all adults, but a large percentage of
Mm.
adults. And actually, what that signifies to the brain for us is that they're just being disobedient, or they're being rude, or they're being disrespectful. I hear that a lot from staff, from teachers in schools where I support. And actually, when we remove the personal element, it doesn't feel so hard to manage. So if we
Mm.
stop thinking that they are doing it to act out, or they're doing it for this reason, they're doing it for that reason, and think actually they're a brain and a body, what do they need? And strip it back from personalizing the whole situation, because that really is what that response and react brain does. It fulfills a need.
I think you're so right on pointing out our role as adults, because you are right. If the child is doing something, all of a sudden we are dysregulated, right? We become dysregulated because what we want to happen is not happening. And even though we're trying our best to validate and reassure and be there for our children, inside you're feeling like, I'm starting to lose my patience, and you're in this sort of like internal battle with yourself, trying to do the best that you can, right? So I think one of the steps as well is to try and regulate yourself, right? Take a deep breath, because when we breathe deeply, actually, right, we're bringing our heart rate down. So the brain all of a sudden thinks, oh, wait, this is not an alert moment. I don't need to be stressed. I'm breathing slowly, which means, that it's not stressful. Then validate, as you were saying, and then walk away of that need of wanting to fix something right in the moment, especially with younger children, because you're right, it's almost impossible to stop a child right there, because they're experiencing this big emotion, and therefore they can't really heal, because the brain is so invested on experiencing this emotion that it's really difficult, right, to hear or to even be distracted by anything. So I think you're right. What's important is to be there for them so they feel safe, to be there for them so they feel also reassured. And then, once they are riding, while they finish riding that sort of like emotional wave, then we can still be there and try and discuss and see, what happened. And sometimes with younger children, especially for us, that sometimes we might work with younger children who find it very difficult to verbalize what's happening
Yes.
inside them. We might want to narrate, right? Because sometimes we can even give examples. Because if you sort of like have you guess what's happening, it could be that something is uncomfortable. You might want to see, oh, I can see that you are upset, feeling upset. I can see that chair is feeling uncomfortable, perhaps.